So we see a variety of clients in our clinic. A lot of clients are perfectly healthy. Others have other struggles, either with mental health or addictions or diabetes as well.
So there is a variety of medicines that we use that are natural from Mother Earth, minerals, plant-based medicines, along with ceremonies, energies. So I think from a holistic point of view, we use it as a whole, the Western and the traditional approach. It's important for us to have that because it does incorporate a balance into our emotional, physical, spiritual, and mental health. If you don't have or are unable to have access to traditional, I think that it can provide an imbalance. So, physically someone might need a Western approach, but also having that connection and having the ability to have the spiritual part to it can provide that balance to help them heal.
I am Mi'kmaq from the Gaspé Peninsula. I've been up here in Ontario, in Cambridge for 40 years, doing construction. My culture was basically vanished. When it comes to spiritual, emotional healing, we had nothing.
And how did you become a client at SOHAC in Cambridge?
That happened by literally accident. Yeah, this last injury from work, I was sent to Altum Healthcare, which is just next door. And as I walked in through the front door here, and I'm looking, what is this? So after a couple of times coming here, I decided to go in and see. And yeah, and they right away, invited me in, and taking care of me. Instead of staying home, sitting down, doing nothing, so I come here.
I think the most common thing that I can see is a lot of trauma. Our people have experienced a lot of trauma due to colonization and oppression and disparities, inequalities, racism. That is, I think, a day-to-day practice when you are an Indigenous person. But also the intergenerational trauma. Childhood trauma is a huge thing.
We hear that a lot, unfortunately, that clients have had very negative experiences at other healthcare facilities, which some clients have said they've been the victim of racist comments. Others have just felt like they were dismissed or not heard about their health conditions by other providers.
About 10 years ago, or more than that, 13 years ago, I started having trouble with my back and my leg. My leg was like quitting, whoop, there we go, down I go. And it was a WSIB claim. They sent me to their doctor down in Hamilton, and his line of questioning had nothing to do with my work. And basically, mentally disabled, alcoholic with a weak back. Even though I've been doing construction, heavy equipment, trucking here for 40 years. And still having trouble with certain groups of people. Like I shouldn't mention them, but yeah, it's a constant fight.
I think to provide cultural competent care is to incorporate that circle of care approach, to provide a wraparound approach to the individual and meet them where they're at. So if they are needing that cultural traditional piece, maybe it's just an introduction. They might not have any knowledge to their culture because of they have been disassociated from the culture due to whatever traumas have happened. But it's important to provide that ability to, that sense of belonging, that they, to introduce, to, be welcoming, to be there just for them to ask any questions without any judgment or shame or guilt. Cultural competency care, the framework is about restoring and reconnecting and rebalancing the individual. That is something very important when you have that cultural competency and in working with Indigenous people in medical field.
For me, as an Indigenous woman, I feel so honored to work here and to have this space for our clients to come. I wish that this has always been here. our services are so great, and it just feels like you're coming home.
It was important for me to have somebody that understood the way we lived. And here at SOHAC, they understand that because we are all one. Like out there, I've had my ups and downs, and coming to a place like this, it feels welcoming.